When you're looking for a counselor, how do you know that you found the right one for you?
Well, I can tell you how I realized I did not find the right one for me.
Oh, what practice was that?
I'm not going to tell you the practice. No way. But, because I don't want people to slam us, I would say one of the areas is that they ask me questions about myself. They really get to know me. And then they discover what goals I want to work towards accomplishing. And then they have the competency to not just let me sit there and talk all hour and reflect and listen, but to guide me on a journey of accomplishing those goals, of walking through the pain to start stair-stepping up into why I came to counseling in the first place. Because what I've noticed is there's a lot of counselors that they ask you every session, like, what do you want to do? What's going on in your life? And it's like Groundhog Day every week, because instead of having a linear plan that they're keeping you on, that is accomplishing your goals, because that's what we're there to do, right? Is help people accomplish their goals.
I think so.
Yeah. They just kind of talk about whatever's on your mind. Now, I also believe that your plan should be subservient to whatever the client needs. So if you've got a plan of working on the relationship with the Father, but their marriage is in crisis, well, then you, of course, need to adjust the plan, because that's what they need in the moment. And I think it's great to have agile therapists that can pivot, and they're nimble, and they can move to what you really need, and they know what is a distraction versus what's a need, and they have the wisdom to walk you to the goals through the needs, and to say, yeah, that's something, let's talk about that later in a different session, but let's really focus on this because you said this is what you wanted to work on, right? And then if you say yes, well, then you move forward. If you say, no, I've really changed my mind, I feel like that issue's been resolved, well, great, check, got that one, move to the next area that they want to work on. And I think I've had to get up in sessions because I've gone to counseling. I've had a lot of things happen to me, especially in 2020, My house blew up and we were all traumatized, and my daughter's in heaven. And I really sought a lot of counseling. And there was, in some sessions they were kind of stuck. And so I said, I'm going to go use the restroom and give you just a moment to recalibrate, pray, think about what you want to say next, and then come back. And I was very nice about it. But I was in a position where I needed to be led and counseled and helped. And I wasn't in a position where I wanted to be the authority and direct my time with the therapist. That's how I appreciate it. And that's how I mentor people at our practice to take people through these journeys.
There are 60-something accredited, empirically supported modalities of counseling. Some of them are directive in nature. Some of them are reflective in nature. Some of them are just straight up weird, and I don't know why people do them.
I don't know, but we had to learn them, didn't we?
We did have to learn them.
So dumb.
And I would say I would love for everybody who calls me to come and be my client forever, but sometimes, well, not forever, but to come and be my client.
It's got a long-term view of counseling.
Sometimes I'm not the right person. And people will know that, I'll know that. And so listening to yourself, just because I was the first person to answer the phone, doesn't necessarily mean that I might be the answer. For you, I might be, but maybe it's Shawn. Maybe you should have called him first. It doesn't matter so much as you pay attention to how you're connecting with the therapist.
That's right.
How are they relating to you? Do they understand you? Do they make you believe that your situation is going to get better and know how to help you to get there? I take a slightly slower approach. Shawn likes a directive approach. I like an approach that's more like a discovery, where you discover your answer, and so you own your answer. You own your path. You own your conclusion. That takes time, but really, if your preference is maybe sitting on a chair and talking to an empty chair. That sounds strange. I don't do that, and Shawn doesn't do that, but there are therapists that are out there that do it. Now, I've never once, Shawn, maybe some people do, I've never once cried myself to sleep because somebody said, hey, you're not the one for me.
Really?
I mean,
that other day you were crying. Okay. Hey, I actually have used that empty chair technique.
Okay.
I don't use it very often. I don't use it very often, but I really do pivot to what people need. And I like a directive counselor, but there's some people that I saw, they like to have chit chat before we get started.
Yeah.
Then there's other people I see, and they like to have it just, as soon as that door opens and it closes behind them, they are ready to go. And I think the uniqueness of the highest tier counselors that you'll find is they are agile, and within the scope of how they practice and who they see, they're able to meet you where you're at. And, there's times when listening, man, with grief, you need to be a fantastic listener, especially in the early stages of that grieving process. That's a huge element to connecting and just being there, and maybe offering one or two things that they can do depending on the stage of grief they're in. And I think that's what you need to know is when you call somebody or when you meet them in person, do you feel connected? Do you feel heard? Do you sense this is a place where you could possibly get some help? If the answer is yes, then continue to invest, continue to spend your money, your time, your resources, and your energy, because that's why you're there. And if it's not, maybe give it one, maybe two more times. And if it's a flat out, if you're not sure, if it's a flat out no, then go somewhere else. But if you're not sure, sometimes it just takes a while to build that rapport, and depending on the issue, it could be really just hard. There's issues that are just hard. I know Kevin's really big in the assessment and the diagnostics and really research, science, fantastic. If I sent him somebody recently that I really felt like they needed his unique, specific set of pharmacological skills, diagnostic skills, and that's where you just are able to blow it out of the water. And it's good to know who those people are and what you need. And if somebody's not meeting those needs, then go to somebody or keep searching and looking until you find someone that does.
When you talk to somebody, Shawn mentioned earlier, we had to study all of those modalities for our test. We are familiar with a lot of various modalities. I have 3 that I really like to use, and I'm certified in 7. Shawn is probably more than that as far as modalities go, but really I want to know the person I'm talking to. I want to find the right fit. Sometimes you're a hammer, sometimes you're a chisel, and you got to be in the right place. But what's more important than modality and the ability to adjust is, do I relate well to this person? And sometimes the answer is just no. If it's no, that's okay, keep looking, but ask yourself the question, if you've been in counseling for years and years and years and years and nothing is changing, maybe you super like a person, well, it takes more than modality, and it also takes more than liking a person. Do your research. Ask yourself the question, where do you want to go, and are you doing the right things to help you get there? It's self-serving for a lot of counselors to say, yeah, I'm the one. They may not be. You know your life and your situation, but don't keep looking and don't keep growing. We can help. Give us a call.